Good morning again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I want to talk to you about uprighting teeth. You have to get teeth tilted properly up to put them in line and everything. It's impossible to deal with them if they're leaning over like this. Now here is a case that's got several teeth that can be uprighted. If she has room enough in there, we could keep all the wisdom teeth, but she has one 6-year molar that's different from what you normally would think of. It's ankylosed, or the tooth structure in the root is grown to the bone, and you'll have to crack it loose and then set it up, get it to re-establish itself. So it's a little different from just uprighting any tooth. But this spring that we have, we'll try to show you how to use it. And so here, we're starting out. This is 1982. That's a long time ago, but we've watched these cases through the years. And here we'll start this young lady. And now this is later on in her life. It's 1987. At this time she's 12 and 5 months, and whether we get these wisdom teeth in or not will depend on how much jaw length she's got when we get there. But we're going to have to upright some teeth to start with. Now one of these teeth, the 6-year molar on the lower right side, is ankylosed, or this root structure is not formed properly in here, and she had these little clips put in her mouth back when she was a lot younger, and this probably had some effect on the attachment of the bony structure to the bony structure of the tooth, and this tooth is hard to move. So you have to kind of break it loose. Or I have an old surgeon or somebody to just crack that loose, and we can set the tooth up in here more or less like that. And then these, if they come in and she has room enough, this will come down. We'll have to tilt it back and bring it in. And these others we're going to line up and have an overjet and overbite correct in there. And that's basically what we did. And in this case, I wanted you to know that you can upright virtually anybody's teeth. Now when they're ankylosed like this one, you got to kind of loosen them up and break the bony attachment down here and try not to damage the tooth any more than you have to. But something has to be done, or else you have to come in and crown this tooth and leave it in that position. If she gets older and these wisdom teeth have room enough, we can come back and upright the teeth without having braces on the teeth or anything. So we'll go through this, show you this case right on down to where we finished. This is 1991 now. And she's matured, and the teeth are lined up good. And we look at the side of this, and that is essentially the thing that I wanted you to know about uprighting teeth. I'm going to draw just a little bit on here. Say, for instance, we had a molar tooth setting over here, and one setting is something like this, and the root structure coming down. You put a little tube on this tooth right here, and you take a piece of rectangular wire, and you may want to have a bicuspid out here, and you can have 2 bicuspids if you needed to, and you make a spring just come out like this, and in this particular case you could just wrap this spring like that. You can go around twice if you want to, and the spring would go off, and here it's hard for me to make the little circle in here like it should be. And then you run this down here, and we come up and we are going to bond it to this tooth right here. So we pull this up, and this comes up and hooks over this bond, and that force that you're prising that tooth up. The root structures in the bone and the crown will move back in nearly every case. The crown will move back something like that, and the roots will move forward a little bit. Once you get it up, then you just slide the tooth forward and fill in the space. Now we show this in real detail in other cases, so if you wonder about this and want to see it, go to one of those cases with uprighting teeth, and that will give you a much better idea about this. And this is a uprighting. Any tooth is essential. I mean, I think if you're going to do orthodontics, don't go in and try to put a brace or a bridge on somebody with a tooth like that. It's so easy to upright it if that's the only orthodontics you're going to do on a case. You can upright it. If it moves back, you can pull it up there, and then you put your bridge or whatever you're going to do in the case. So learning to upright teeth is essential in doing orthodontics to me. And these springs, the different ones, if you can't do the upper bend like this, you can come in and make it down on the bottom, and you come up, and you can upright that one if you point the circle down or point it up, either way like that. It'll make it'll put the force on the tooth, and you can upright it. So the urge is, if you really want to look at that, just go and click on some of these cases of uprighting teeth, and it'll go through the very detailed work, putting it in there. And any tooth can be uprighted. If it's ankylosed, you have to break it loose. So before you do, so that's about all on that subject. So we hope that you'll see that and go and join our little group here and subscribe to this. So thank you for watching, and I'm going to close out here, and we'll hope to see you again.